Welcome, my name is Peter Strong. I offer online therapy via Skype. So if you're interested in getting help for overcoming anxiety or depression or addiction or any other psychological problems that are affecting the quality of your life, then you might want to consider online therapy sessions with me. The great advantage of online therapy is that you can have your sessions at home. So home-based psychotherapy is something that's becoming more and more common now. It's very convenient and it's just as effective as meeting in person, as long as you use Skype or similar video platform. If you can see each other, then the quality of communication is just as good as meeting in person for the majority of people. Certainly that's the experience of the clients that I've seen over the years now. They find it's just as effective, and many times it's even more effective simply because people feel more comfortable, they feel less intimidated, and more receptive generally to the teachings that I will give you during these psychotherapy sessions. It's very important that you are comfortable, especially if you're struggling with anxiety or depression or addiction. It's very important indeed that you feel open and free to explore the underlying emotions that are causing your suffering. So the style of psychotherapy that I teach via Skype is called mindfulness therapy, and you can read a lot more about mindfulness therapy on my website. Mindfulness therapy is similar to cognitive behavioral therapy in that it teaches very practical methods of working with anxiety and depression. It's less based on abstract concepts and more based on the actual process that is causing your emotional suffering. For example, habitual reactive thinking. Cognitive therapy, of course, focuses very much on those repetitive and intrusive thoughts that cause your anxiety or depression or OCD or whatever it might be. Mindfulness therapy takes CBT to the next level because it works more at the level of emotion, the feelings underneath the thoughts that actually are what power those thoughts. So trying to change thoughts alone is usually not quite enough. You have to change the underlying emotion itself, the anxiety or depression that is fueling those thoughts and beliefs. So that's more the approach that I teach in mindfulness therapy sessions. We work on changing the way that we relate to our emotions and thoughts. This is very critical because the biggest problem that I see is that people simply become completely identified with their emotional reactions, their habitual emotional reactions, and also they become identified with rumination and patterns of worrying and thinking that simply feeds those underlying emotions. So we have to break free from this problem of reactive identification. We have to learn to develop an independence in relationship to our emotions and to our thoughts and beliefs, and also to our memories as well. We have to be able to see them objectively. And this is a big theme in mindfulness therapy, the process that I have been working on for many years now. It's about learning to develop objective consciousness so you can see the thoughts and emotions and memories without becoming overwhelmed by them, without becoming lost in reactive thinking or emotional reactivity. That's very, very important. If you do not change your relationship to an objective relationship, you will not be able to break free from those patterns of emotional suffering. So that's the very first part of mindfulness therapy, is developing this objective consciousness, to be able to see your mind rather like seeing a movie on a screen. You have to develop that independence. When you have done that, and when you can effectively stay conscious and present with your mind, with your thoughts and emotions without reacting, then you can begin to bring about change. And in mindfulness therapy, the change process is described as the response of compassion. That is where you're learning to develop a compassionate relationship towards your own mind, to your thoughts, your beliefs, your memories, your emotions. You have to start approaching them in a way that helps them heal. If you simply react out of habit, they can never heal. They just continue to burn in the mind, essentially, like a fire. But if you can develop an objective relationship with your emotions, and then you can start to respond compassionately to help those emotions change, then you are well on the journey to extinguishing that fire, on promoting healing in the mind. So healing is our primary objective here. If you're working with anxiety or depression, we want to be able to look at the triggers that trigger anxiety and depression, and we want to be able to neutralize those habitual reactions to those triggers. So mindfulness therapy is really good at healing and neutralizing the underlying emotions that feed the thoughts and beliefs that sustain anxiety and depression. If you would like to learn more about Skype therapy and the home-based psychotherapy program that I offer, do please go to my website and feel free to email me, ask any questions you have, and when you feel ready, let's schedule a Skype therapy session so you can begin to get a sense of the incredible power of developing mindfulness in relationship to your mind. It is extraordinary, the changes that you can produce just by changing the way that you relate to your mind, developing that objective consciousness that is so much the hallmark of mindfulness. Learning to be present with your mind. So if you'd like to learn more and get started with some sessions with me, do please contact me. Most people see quite incredible changes within relatively few sessions because it is so practical, it's so focused on changing the mechanism that causes your emotional suffering. So if you'd like to get started, please contact me now. Thank you.